Part 9. The MAiD Explosion. How Eligibility Turned into a Nationwide Surge, by Canadian Citizens Journal. MAiD was introduced as a rare, last resort option. When medically assisted death was legalized in 2016, Canadians were promised it would remain rare. Tightly regulated, restricted to extreme cases, used only when suffering was unbearable. A compassionate option, not a default, never applied to vulnerable people under pressure. The message was simple. Assisted dying would never become normalized. 8 years later, it has become one of the fastest expanding medical practices in Canada's history. What began as an exception has become an expectation. The numbers do not lie. MAiD has skyrocketed. Federal reports show a surge unmatched anywhere else in the world. Within only a few years, annual MAiD deaths increased more than tenfold. MAiD became one of the leading causes of death in some regions. Canada reached one of the highest euthanasia rates globally. Expansions continued despite serious warnings from oversight bodies. The government prepared for even broader eligibility, including mental illness. This is not a gradual increase. It is an explosion. How Canada became the outlier. Countries such as Belgium, the Netherlands, Luxembourg, and Switzerland all have assisted dying programs. None expanded eligibility at the speed or scale Canada did. Canada moved from terminal illness, chronic illness, disability, chronic pain, broad conditions, mental illness, advance requests, all within a decade. No other country attempted to include dementia patients who cannot consent, advance directives for people who are not currently suffering, poverty or lack of services as a form of irremediable suffering, individuals whose primary struggle is isolation or inadequate care. Canada did not follow international standards. It surpassed them. Timeline of expansion from rare to routine, 2016. Limited to terminal diagnoses, promoted as strict and narrow, 2019. Courts push for broader eligibility, restrictions called discriminatory, 2021. The requirement for death to be foreseeable is removed. One amendment changes everything and opens the system widely, 2022-2023. Mental illness scheduled to be included. Public backlash leads only to delays, not cancellation, 2024-2025. Preparations for advance requests. Allowing future euthanasia based on a past directive, even without present-day consent. Ongoing. Growing push to classify poverty and lack of supports as legitimate suffering. This is not a careful program. It is rapid expansion toward anyone experiencing distress. The most alarming trend, MAiD shifting into social suffering. Ethicists once warned that assisted death must never be used to solve social problems. Yet that is exactly what has happened in Canada. Many recent MAiD recipients were approved because they could not afford accessible housing, could not get adequate home care, could not secure disability benefits, could not get treatment for chronic pain, could not find safe shelter, could not access specialists, felt abandoned and alone. This is not medical ethics. This is administrative triage. The government knew MAiD would reduce costs. Economic reports and internal analyses acknowledged that MAiD would significantly reduce healthcare expenses. Some projected billions saved over time. Expansions that shocked the public were aligned with financial incentives. When people needing expensive care die earlier, the system saves money. Whether intentional or tolerated, the outcome is identical. MAiD has become a default alternative to crumbling care systems. MAiD is increasingly offered when care is delayed, inaccessible, too expensive for systems to provide, understaffed, inconsistent, overwhelmed. People once seeking relief now receive discussions about death. Workers inside hospitals and long-term care facilities report the same trend. MAiD is being introduced earlier and more casually, not because suffering is new, because support is gone. The rise of pathway patients. Canada has unintentionally created a new category, pathway patients. People who become eligible for MAiD because the system never provided the support needed to keep them alive and stable. This includes seniors in long-term care declining from poor nutrition, residents pushed into palliative status due to staffing collapse, disabled individuals drained from fighting for benefits, chronic pain patients denied treatment, youth facing years-long mental health waitlists, people overwhelmed by homelessness and poverty. When support collapses for long enough, suffering becomes irremediable. Why this expansion matters for long-term care. Long-term care is now one of the strongest pipelines into MAiD, because long-term care homes are facing rapid resident decline, unsafe nutrition, chronic understaffing, fraudulent inspections, premature palliative labeling, preventable suffering. More residents meet the conditions for MAiD every year. The cycle looks like this. 1. The system causes decline. 2. Decline produces suffering. 3. Suffering meets MAiD criteria. 4. MAiD numbers rise. 5. The system uses those numbers to justify fewer resources. This is not a safety net. It is a loop. Canada now has 2 parallel systems. One system exists for those who can pay privately, private specialists, private clinics, private home care, private rehabilitation, private mental health services. The other system is for those who cannot, collapsing long-term care, inadequate disability supports, homelessness, unmanageable waitlists, palliative pathways. MAiD. One system offers treatment. The other offers an exit. The MAiD explosion is the result of policy, not choice. When support collapses, suffering rises. When suffering rises, eligibility increases. When eligibility increases, MAiD numbers soar. This expansion is not driven by Canadians seeking death. It is driven by systems that stopped offering life.